That a virus could cause a country to come to a standstill, let alone the entire world, was something out of a horror movie or fiction novels.
This virus killed more people in the first 25 weeks than HIV/AIDS has killed in 25 years.
The last of such a kind was the deadly Spanish influenza, which killed 50 million people worldwide in 1918. On 31st December 2019, a flu-like disease was reported to be affecting the people of China in Wuhan province.
As of this morning, there have been 571 cases confirmed by the Chinese government, and 17 people are reported to have died of this new strain of respiratory illness.
But that was far away for Uganda.
China has identified the cause of the mysterious new virus.
Coronavirus.
There are fears a rapidly spreading virus has reached Australia.
This is a rapidly emerging situation.
From China, the virus was fast detected in Europe and other countries. But in Uganda, life continued as normal.
We thought that the problem was still far, like SARS before it was there, the flu. In China and somewhere it was contained.
The virus was barely of any concern. The markets were full, churches and mosques were active, the roads were busy, the nightlife was buzzing, and everyone was normally going about their business. Even when the first official corona death was announced in the world, causing a sense of fear and panic among many, Ugandans continued with life normally. In any case, what can be worse than malaria, which kills almost 3 million a year? Also, the Ministry of Health in the country had a great experience in managing epidemics like Ebola, cholera, among others.
When COVID broke out, we were also in the response, epidemic response for Ebola.
Having had a wealth of experience from managing epidemics, had an upper hand in how to handle this pandemic. It is still new.
But when the first case on the continent was reported in February 2020, fear started trickling in.
Countries around the world have now reported more than 1 million coronavirus cases.
COVID-19 had landed on the African continent and closer to home. Fear and reality check started setting in.
When it started spreading very fast like wildfire, and at the time when World Health Organization declared it as a pandemic, that's when really we knew that we had to get prepared.
To fight the invisible enemy, a COVID-19 task force was formed.
We didn't have a lot of information around it, and we needed to have a team of specialists that would not only look up the existing knowledge, but probably also generate new knowledge that is important for the country.
His Excellency the President appointed a national task force to oversee. So it was not only left to the health sector, but all sectors came in to handle areas that were in their lines of duty.
Coming right down from the districts, coming from the regions. So on a daily basis, we follow the numbers, we follow the number of contacts, we follow the number of cases, we follow the number of deaths. Each death for us teaches us a lesson. We follow clusters of transmission, and we follow trends in how the outbreak is, or the pandemic is moving, and make decisions according to that.
I remember the first day when we left cabinet at night, and they told us effective from today, everyone coming in the country must be quarantined. And that time really it was just something that we did not understand. COVID was very new. We had little information about it. We didn't know even whether it was transmitted through air and all that, but we had to, to take action.
With that came the first presidential address on the virus.
Today I have come to address you on the issue of the coronavirus.
The country hadn't registered a case yet, but the entire population was glued to their TVs and radios, listening in for guidance from the head of state on how to behave should the virus get home.
Because being a new virus, all of us do not have immunity against it, because we had never been exposed to it. It is wise that we temporarily remove these concentration points by closing all the primary and secondary schools, pre-primary, as well as all the universities and tertiary institutions for 1 month. Encourage people to work from home whenever possible and revert to 30% physical presence at workplace for 42 days.
Everyone adopted to working from home. Prayers were online.
We advise for a lockdown. The hospitals are full. We have a loss threshold for critical care, and this is the unfortunate side. Even the countries that had built a lot of capacity for critical care, countries like Spain, countries like the US, they were forced into these circumstances. What about us, who have really a small threshold for critical care?
It was hard for many Ugandans to adopt in the beginning.
Go home. Go in the market. You're not allowed here.
In some breaking news, there have been 10 more deaths.
The death toll from the outbreak of coronavirus in Italy has surged.
However, after seeing on TV and hearing on radio about how the virus was ravaging European countries, the best option was to adhere to the president's guidelines.
This virus enters the body only through the soft parts of the body. It cannot go through an intact skin like some of the diseases used to.
The soft parts, mouth, eyes and nose, were to be avoided. No touching. Everybody was cautious not to touch their soft parts, as this is where the virus would pass to enter the body.
We had to prepare ourselves by getting key information on COVID-19. The major 3 key issues at that time were we wanted to keep the public know, especially on how someone can easily get COVID-19 and how best they can avoid it.
If an infected person sneezes out or coughs and you are near, and that watery breath gets into your nostrils or your eyes, that's how you will get infected. Or what is sneezed out falls on a surface, like a table where you touch, and then you touch yourself in the soft parts. That's how it will go into you.
The Ministry of Health put in place several standard operating procedures and guidelines to avoid the spread of the virus.
Don't get anybody near anybody who is coughing or sneezing. And if you are sneezing or coughing, please don't go in the public. Excuse yourself. Stay at home. Always wash with water and soap.
COVID-19 call centers were put in place by the Ministry of Health to help anyone with symptoms related to the said disease to reach out and get all their queries answered. And 2 days after the president's address, the most dreaded news hit home.
Uganda has confirmed her first case of coronavirus disease.
It was a 36-year-old male who had traveled to Dubai on 17th March 2020 on a business trip. On returning to Uganda on 21st March 2020, at around 2 a.m. aboard Ethiopian Airlines, his temperature read 38.7 degrees Celsius during the screening process at Entebbe Airport. Promptly, the health team at the airport isolated him. The first wave of the virus was upon us.
The other time we were trying to prevent, but I think we were late by a day or 2, because that's how all these cases, 9 of them have come from Dubai.
Borders were closed except for cargo and goods. a directive was passed for public transport to be suspended for 14 days. Restrictions were put on private vehicle movement too.
The ban on the use of privately owned passenger vehicles will take effect from 2200 hours, which is 10 o'clock, Shahina Zekiro, Sawa Nya Zekiro, Sanne za usiku, today, the 30th of March 2020.
From the time when the World Health Organization notified the entire global community about an outbreak of a viral fever that had started from China, Uganda started preparations to handle the outbreak.
By mid-April, the number of COVID-19 cases in the country had increased rapidly.
Kampala reporting an average of 500 cases per day, followed by Wakiso and Gulu, which have consistently reported over 100 cases per day.
And majority of the positive cases were truck drivers transporting cargo. A directive on mandatory testing of all truck drivers was passed. A Legu border was one of the entry points of concern. The different district health officers too were all prepared for the pandemic with guidance from Ministry of Health.
For us, we just transitioned from Ebola response to COVID response.
It's the first of its kind that I've been in the front line of this, and it's a demonstration of the love that we have for serving the country.
Our response teams are very, very committed, very active, and ready to go even the last mile.
It was such a stressing situation.
The situation was getting serious as cases kept increasing.
When we started declaring that, now we've got 20, we've got 30, and the people started saying, oh, now this is the concoction of Ministry of Health. They want money. They want money. You see, I remember one person sent a message to me and said, wonderful, congratulations. So how many people are you targeting in this week to get, like, how much money are you likely to get, When you declare 10,000, don't you think that's good money?
And something that the post-NRA war generation had never experienced was declared: a nationwide curfew.
Starting with the 31st of March 2020, at 1900 hours, which means saa moja ya usiku, there will be a curfew throughout the whole of Uganda. All other movements should stop.
People adopted to working from home. The streets of Kampala remained clear and silent. It was quiet.
If you are found with a forged sticker, your vehicle will be impounded until after the whole period of the coronavirus is over, because we'll be charging you for deliberately wanting to transport the virus.
Only essential workers were allowed to move. These included doctors, journalists, food vendors, and security. Presidential addresses became the norm. In May 2020, wearing of masks in public was declared mandatory.
It is, however, crucial that everybody that is going out in public should wear this mask, the other one, the ordinary one. First, at the end of each day, put off that mask, wash it with soap, dry it, and iron it.
By that time, there were 200 confirmed cases. However, this was reduced to about 145 after foreign truck drivers were deleted from the Uganda data. The nationwide lockdown was extended by yet again another 14 days. Towards the end of May, some restrictions were eased. Private cars with only 3 people and general merchandise shops allowed with strict social distancing.
The supermarkets will remain open and operate with strict observance of SOPs and close at 7 p.m. The food markets should continue operating but enforce SOPs. The market leaders will be held liable for non-compliance to SOPs. Saloons, lodges and garages are allowed to operate up to 7 p.m. with the strict SOPs.
We have a strategic approach that was premised on a matrix for reopening of sectors, really looking at 4 factors: the economic contribution of a sector, the availability of mitigation measures for transmission in that sector, the vulnerability of the sector.
Public transport in non-border districts resumed, however, passengers were at half capacity.
Public transport within the same district is allowed with strict observance of SOPs as previously described.
By June, the COVID-19 cases crossed the 1,000 mark. There were some recoveries too, and the Ministry of Health came up with the National Coronavirus Preparedness and Response Report Plan that explained how they intend to deal with the virus.
Among the best countries in the world, one of the key strategies they picked from Uganda was our health sector COVID-19 communication strategy, and we hope that it has been adopted by many countries, and we think that it has helped many countries to engage with the public in a more meaningful manner.
Because we knew the science and we had to stick to the science, and that science helped us to deliver results. Uganda is one of those countries that have made tremendous progress in fight against COVID. Actually, we have been exemplary in Africa, not just Africa, but I think globally. Because for us, we didn't have to go according to what other people are doing. We had to localize our solutions, and that's why even when I was hearing people criticizing government that we closed the schools for too long, we had to devise our solutions that are suitable for our country. We looked at their life as the most important thing. The rest would come later.
We know that COVID has affected many people socially and economically, so many people had lost hope. So we came up with a new campaign slogan called Kijja Kugwa. The Kijja Kugwa campaign is meant to restore hope to people, to know that COVID will come to pass, but we need to do something before we get there. And what we need to do are the public health preventive measures, what many people these days call them SOPs for COVID-19.
Unfortunately, however, on 23rd July 2020, the country recorded her first death from the virus.
That Uganda has registered the first COVID-19 death. The deceased is a 39-year-old Ugandan. I want you to note that this is a Ugandan. She presented with signs and symptoms consistent with COVID-19 and with all the clinical presentation that included, she had a fever, she had a dry cough, she had headache, and she had difficulty in breathing.
As the world surpassed the 20 million COVID-19 cases mark in August of 2020, Uganda was at 1,652 active cases with about 32 deaths. The country, under the stewardship of the Ministry of Health, was against all odds managing to contain the spread.
We start now getting people who are sick, and we said everyone who is positive, regardless of whether you have symptoms or not, because you are a threat to other people, we shall isolate you. Then we started putting the patients in our hospitals. We created COVID treatment units.
There were 14,757 new cases, raising the total number of confirmed cases to 35,216. The death toll rose to 251.
The highest number of deaths for COVID-19 happened when the people who need oxygen begin to seek for oxygen, but they cannot access a bed where to get oxygen. If I have few beds for intensive care, as well as high dependence care. I am watching out. I need to be able to figure out how many more days will these beds get full. And for me, once we hit a threshold of 75%, I have to leave this 25% reserve. So I have to close down activities.
Tough decisions had to be taken. Uganda's electoral campaigns for 2021 were halted in Mbara, Kabarole, Luwero, Kasese, Masaka, Wakiso, Jinja, Kalungu, Kazo, Kampala City, and Tororo. The number of recovered patients increased to 11,733, leaving 23,232 active cases at the end of December 2020. The usual Christmas season festive mood was rather somber. Almost all the usual party places remained under lock and key. People stayed closed in their houses just like any other day, and the death rate kept going higher. The usual fireworks and the almost traditional burning of tires in villages to usher in the new year was hardly done.
Displays of New Year fireworks been cancelled due to the uncertainties caused by COVID-19.
However, the general elections activities went on with calls for strict adherence to the wearing of masks, social distancing, sanitizing, and washing of hands regularly. The push for the vaccine had intensified earlier, and the United Kingdom and the USA had got a breakthrough, but through the campaign period all the way to the voting day in February 2021, the vaccine was still a distant wish.
Number one is still being worked on, the vaccination. The people in the world are working on it. Even here, we have started trying to develop a vaccine, even here.
Free vaccination in Uganda began in March with the first consignment of 864,000 doses of AstraZeneca vaccine acquired through COVAX, a platform that was set up by the developed world to avail vaccines to the African nations. Subsequently, Uganda received a donation of 100,000 doses of the same vaccine donated by the government of India.
From the onset, it was very difficult to access vaccines because many of the rich nations had made their bookings during research and development of the vaccines. And Africa, as a continent, came in through the COVAX facility. And so we're mainly benefiting from donations from countries that had access or through what COVAX facility had mobilized. And so it took a bit of time for us to start accessing the vaccines. Our first vaccines came into the country in March. Specifically, we received it on the 5th of March, and we launched on the 10th of March and set out to vaccinate.
The Ministry of Health set an objective to vaccinate 21.9 million people and to start lifting restrictions once 4.8 million had been fully vaccinated.
The doses were quite few, and in such instances, you have to be very careful about how you deploy the vaccines and who accesses the vaccines. We have vaccinated nearly 1.8 million people who have received their first dose. That is about 8.2% of our target population of 22 million people. And those that have received their second dose are about 580. We set a criteria for vaccination, which was to cover the most at-risk populations, and these included the health workers, the teachers, security personnel, the elderly, 50 years and above, and those with comorbidities to get vaccinated first, because this target group or this priority group are very vulnerable to hospitalization and death in the event that they contract COVID.
There was a lot of propaganda within the country on the vaccine.
They are giving injection, the president got another whatever. They are pretending Then we had to make sure that everyone was vaccinated in front of a camera.
Ministry of Health, together with the media, kept updating the citizens on the importance of the vaccine and spreading the message for everyone to go get vaccinated, as it was the only way to combat the deadly virus. In June 2021, Uganda re-entered a partial lockdown. A presidential directive banned travel between districts, restricted gatherings, and suspended schools and communal or religious gatherings for 42 days in response to an uptick in community spread of the virus. Those who refused to follow the new lockdown regulations would be fined instead of arrested. There was an upsurge in case patients since end March 2021, following a 3-month period, January, February, March 2021, of controlling the epidemic with an increased positivity rate of 17%. Then came the second wave. It was more deadly and intense, and the most affected age group in this particular wave were the 20 to 39-year-olds. There was also an increased transmission among the 10 to 19-year-olds and infants and youth.
It was a challenge, the second wave, when we had really, really big numbers swell, and we're seeing that, people would share on the social media what was happening in India and other countries. So people were paranoid. So whoever would get COVID, they would think that now death sentence. Then they would all come run into the hospital. Then you don't have enough space, and then the others want oxygen. Then they are stuck in the parking in the cars, demanding that they get the oxygen that administered in the car. It was a tough time.
In all our estimations, in other preparations, we never knew that it would to come really down to one single aspect. For example, oxygen, where we had a stretch and stretched all our oxygen capacities because patients were consuming so much oxygen and at all time.
The numbers were increasing day by day. The hospitals were full to capacity. Nambole Stadium was turned into an auxiliary COVID-19 treatment center for asymptomatic and mild cases.
At that time, the patients were too many all over the country, and hospitals like Mulago were also getting overwhelmed. So the ministry decided that, let Nambole also admit those who require oxygen. So in that way, it was made almost like a hospital, and we were providing services similar to those of a hospital, putting patients on oxygen. And we know that at that time there was a time when there were many patients who needed oxygen, and actually oxygen was in short supply. Some patients would come into the facility quite late when they have been sick for long. So, and eventually we lost about 70 patients.
There was a lot of demand for oxygen in the hospitals, leaving many desperate to go to private facilities that were expensive. Uganda recorded her highest number of deaths between June and July. With the highest number going to about 80 persons a day, the virus was hitting close to home for many.
Compared to many countries, whereas we've had many infections, the death rate has remained not so high. So far we have lost, unfortunately, over 3,000 people infected with COVID who have passed on, sadly. But compared to our neighboring countries, our numbers are still relatively low. I do hope that if the population adhere to the standard operating procedures, which still work up to today, even after vaccination, our rates will still remain low.
The lockdown was tightened only to be relaxed in July, when the country received and vaccinated more people. In November 2021, Ministry of Health surpassed its set target of 4.8 million Ugandans getting vaccinated, and it continued to encourage all its citizens to get vaccinated, with the promise of reopening all sectors of the economy eventually. Vaccination taking place and Ugandans heeding to Ministry of Health's advice on observing the SOPs, one would believe the COVID-19 nightmare was finally coming to a standstill. Then, towards the end of 2021, came the third wave with the Omicron variant.
The third wave was characterized by Omicron variant, which was slightly less virulent because it tends to get to the upper respiratory tract other than going down like Delta. And so we saw less demand for oxygen, although the numbers, this time the wave or third wave, the numbers were much more, but we saw less demand for oxygen, less demand for admission. And because also we had vaccinated a big percentage of our population, we had covered, I think, about 30% of the population vaccinated. So that lessened the complications, lessened the number coming to the hospital, and that helped us to minimize the deaths.
In January 2022, curfew was lifted the same week students returned to school. Some bar owners prepared for reopening. Uganda was finally open, leaving many excited as they were eager to get back to normalcy. We had 63% of the population vaccinated and 35% fully vaccinated as of the beginning of March 2022.
One of the key mandates of the Ministry of Health is to ensure that strategies and plans and guidelines are in place. That has been done by the pillar. I think that as a country we have done well. There are those good things we have learned from COVID, which we are going to carry on in terms of educating the public on other emerging public health emergencies.
The Ministry of Health continues to implement an accelerated mass vaccination campaign and encourages people to go for the booster shot.
It is better that people have recovered, they wait a little, like maybe 3 months. When the antibodies begin to go down, then you get another booster. Because if I recover now and then tomorrow I get a booster, it will not add big, it will not give me big push. It will just maintain more or less the status quo.
The world didn't see the virus coming and was unprepared for it. The country has since gotten back to normal. All sectors of the economy have been opened. The ministry continues to be vigilant in keeping the country and its citizens safe by encouraging Ugandans to get vaccinated and continue observing the SOPs. To all the lives that were lost during the pandemic, may they keep resting in eternal peace, as we hope that this nightmare will be defeated for good. Keep safe, get vaccinated.